Yes. Could you tell me more about BioLizard and how you support the life sciences industry?
Yes, sure. BioLizard is a data science consulting and service company. We offer data analytics driven services for biotech, pharma and diagnostic companies. So in the end, we really want to make sure to all those companies that it's important to start from the data, to learn as much as possible from your data when you want to develop a drug or biomarker. So if companies start early on discovering their data, then they can hopefully improve their drug development, do it faster and also cheaper.
You help them with every step of the way with that?
We focus a lot on discovery, so very early on, and also during the preclinical phases. We also help them in phase 1 and phase 2. We're less involved in the later stages. We believe as early as if you start working with your data as early as possible, that you will get the most success out of it.
So the number of delegates attending Bio Europe is higher than ever. Are you already fully booked?
No, I'm quite fully booked, and I see there is an increasing interest in talking to companies, being able to support biotech and pharma companies with their data. So it's indeed an emerging space, and I have quite some meetings, which is great, of course.
Do you find with the meetings that it's a mix of people that know a lot or people that don't?
It's definitely a mix. Some people are very well aware what is possible with data. Some people actually have no clue, which is also good because then we still can educate them, but it's a mix indeed.
The depths of IT and AI might be overwhelming for some scientists. How do you go about addressing your clients' data challenges and sort of take them along?
Yes, for us it's very important in the beginning when we talk to potential customers to understand how much they know already from IT and AI. And often we're indeed not talking to people with that deep expertise, and then it's very important to, when you explain something, that it's very easy to understand for non-computational people. So our team is very well trained in explaining results and what they do, methodologies that they use, to explain it to scientists like biologists, doctors, but not computational people. So.
And I guess that all of their needs will be different.
Yes, but in the end it's very important that the outcome is medical and clinically relevant, and for each of the scientists that is important. It's also for us very relevant to put ourselves in the shoes of the client. So it depends who you talk to, and then you change your message, you change the depth of explaining to the audience, let's say. Myself, I'm a vet actually. I'm not a data scientist, so I always tell them, make sure that I also understand it, and then the client will understand.
You said you recently launched your new platform. How does that fit in with your service strategy?
Yes, so the platform that we launched is BioVerse, and we strongly believe that as a company you have to be computer-centric but also human-centric. And by developing that platform we really can combine both approaches. So AI, it's very computer-driven, but on the other hand you can't do AI without that human context. And BioVerse enables us to use an AI and bioinformatics-driven platform and to deliver data in a very interactive and professional way, but on the other hand it's still the humans that do the data analytics. So it's a combination of the platform with the human services, which will professionalize our services even more, even better. So that's the goal. It's very user friendly, it's a very custom platform, very interactive, and again, people without a computational background, like biologists for example, they also can interpret the data, look into the data. So that's the entire idea behind the platform.